I want to talk about this article. Well, it's backwards, but it's called Ditching the Blame Game, Effectively Responding to Medical Errors. It's in the most recent episode, the most recent JAVMA. And this happens to be something I am weirdly passionate about. A little background, I used to be an ICU nurse in the human medical field before I applied to vet school. At the human hospitals, they are obsessed with medical errors in a good way. They are very, very serious about catching and addressing medical errors. And I came from a hospital that, they did it so good. Christiana Care Hospital in Delaware, so good. And basically what I thought they just did so much better than anywhere else I've ever worked is they did not play the blame game. They had something called the good catch system, which, first of all, you're saying good catch, you caught this medical error, instead of being like medical error reporting system. And I just think that's so much more effective in getting people to take down their guard and their pride and to actually report these medical errors. And it was an anonymous reporting system. So when I came to veterinary medicine, I was floored by how little oversight there is on different medical errors. And some of it is just because it's veterinary medicine. There's not as much money in it. And that's a huge factor because it's really expensive to pull out all the bells and whistles with keeping track of medical errors. And another thing we don't do, we don't scan meds. We can't talk to our patients. Oh, and also, while in human med, they're all registered nurses that are giving and administering medications. In veterinary medicines, a lot of times it's registered veterinary technician, which is the equivalent of a registered nurse, but a lot of times it's not. A lot of times it is just on-the-job trained assistants doing it, which is a lot. That's a lot of responsibility to put on somebody who does not have a license to defend and does not have the extensive education and training that registered vet techs or registered nurses have. So just a little look into why I care about this and why I think it is so, so important in both human and veterinary medicine. And I will have to do another video talking about this article and why I think it is so great.